Plaque and hardened tartar can accumulate around or low or below the gumline, where deposits may be difficult to see. A dental professional evaluates the gums and tooth surfaces to identify areas where hidden buildup may require professional cleaning. Saw plaque can harden into calculus over time, creating deposits that may remain attached beneath the gumline. Using professional techniques, the affected tooth surfaces can be carefully accessed so attached deposits can be removed. The professional continues cleaning affected root surfaces to remove remaining accessible deposits attached below the gumline. The professionally treated area may then be rinsed to help clear loosened debris from around the clean tooth surfaces. After cleaning, the area is checked again to evaluate the treated surfaces and determine whether further care is needed. Professional below gum cleaning can remove accessible deposits, while ongoing care depends on each person's individual gum health. This video is for general education only. For gum concerns, please consult a qualified dental professional.